Clinical and forensic psychologist, Dr. Daniel Bober.
Now for the top story tonight reaction. Joining us from Miami, Dr. Daniel Bober.
Clinical and forensic psychiatrist, Dr. Daniel Bober.
We have psychiatrist Dr. Daniel Bober.
Please welcome Dr. Daniel Bober.
Dr. Dan Bober out of Hollywood.
Dr. Bober, thank you so much for being here.
Thank you. So glad to be here.
Joining our panel is Dr. Daniel Bober. He's a clinical forensic psychiatrist down in Miami. Dan, great to see you.
Bill, I really couldn't disagree more. I think that we're sending them the wrong message to tell them that they're special. I think we need to be much more realistic. And we're kind of living right now in this eggshell generation. And unlike Humpty Dumpty, we have to teach our kids that they're going to have to learn to put themselves back together again. The school is spending as much time with them, if not more, than their parents are. The school has to take some responsibility in this, too.
Clinical and forensic psychiatrist, Dr. Daniel Bober.
I think it was a tactical mistake not for him to take the stand because, you know, this is not a monster. This is not a habitual criminal. This is basically a teenage kid.
Psychiatrist Daniel Bober advises parents to be more vigilant.
The problem with kids that age all congregating in the same area is that there's sort of a mob effect where if one child goes along with the behavior and the other children witness it, they don't have enough ego strength or self-esteem to speak up, so they all sort of go along with it, and it almost becomes normal.
We have child psychiatrist Dr. Daniel Bober here to tell us about the issues your child may be facing.
Linda got help from psychiatrist Dr. Daniel Bober.
Sometimes people are afraid to seek help because they feel that they're going to be stigmatized or judged in some way. To be using the term messing around indicates to me that he doesn't really appreciate or respect the seriousness of handling a firearm. Through his own negligence, he left out many steps in the process that may have avoided this tragedy.
Are those some of the signs that parents can look out for?
Absolutely. It's one of the few mental health disorders that medication is really the most effective.
Okay.
I always try to make medication the last resort when it comes to children because I think they should try to do it with therapy first.
If parents suspect that their child is being bullied or is the bullier, what can they do?
They can call the school and speak to the counselors. They can limit their internet time. The most common form of cyberbullying is instant messaging, and approximately 30% of school-age children who are on the internet have been bullied at some point. That is the part of the brain that says, wait, stop, I need to think about this before I do it. I need to put the brakes on.
A medic in the Navy, he witnessed tragedy we only hear about.
The front of my head hurt so much that I would pass out for a few seconds.
And is currently in treatment with Dr. Dan Bober out of Hollywood.
Service members have very unique needs because of things that they're exposed to in the battlefield.
Service members' suicides are now tracked by the military. There have been 1,100 deaths since the wars in Iraq and Afghanistan began.
I think the only person she's interested in saving is herself. I don't think she had any remorse. Basically, she's been caught and she knows it, and I think she's under extreme anxiety because of it. And I think she's doing the best she can to try to put on a good face. I've had multiple people tell me that they've had problems obtaining the medication.
Dr. Bober says people are being forced to go from pharmacy to pharmacy until they can find the drug somewhere.
We have psychiatrist Dr. Daniel Bober here to explain why this happens.
We are creatures of habit.
Yes.
We engage in patterns of behavior, and we stick to those patterns of behavior because we find comfort in the structure. Realizing that, you know, I'm the one that's responsible for this situation, so I have to take ownership of it, and the only way it's going to change is through me.
She brought him to psychiatrist Dr. Daniel Bober and learned the foods her son was eating could be making his condition worse.
We know that certain chemicals that are synthetic, whether they're dyes or in the environment, can sometimes cause behavioral symptoms.
Dr. Bober says of the millions of people with ADHD, up to 30% of them may be affected by food coloring. So, the advice for parents?
I'm telling my patients that they should be aware, and before they put their kids on drugs, that they may want to consider a restriction diet. Really something that reshaped a generation. We are offering services to people that have insurance or that don't have insurance as a way to try to give something back to the community to help the people that really have suffered from this tragedy and still continue to suffer.
I think it's improved my life, which I wouldn't have done without my doctor.
Dr. Daniel Bober, so valuable for your input today. Fascinating information. Thank you.